All right, over now to Malaysia. It's looking into setting up its own vaccine development research center to fight the coronavirus pandemic. And that and more news from our EBC correspondent, Ruby Tinawin. Hello, Ruby.
Hi, Alma. Good afternoon.
Good afternoon. Thank you for joining us again. What
You're
are your
welcome.
updates for us, Ruby?
Okay, here are the news for Malaysia. Serious discussions are being held at Malaysia's Ministry of Science, Technology and Innovation on setting up a vaccine development research center. This is to enable the country to manufacture its own vaccine. Deputy Minister Ahmad Amzad Hashim said the setting up of the center was seen as crucial to deal with the spread of COVID-19 or any other infection or pandemic in the future. He said many experts in the field of biotechnology and at one time have had biotech laboratories, but not much focus was put on them. So, however, he pointed that the ministry cannot confirm that the vaccine will be produced in the near future. He said the production of one vaccine involves a long process of up to 2 years and may involve an allocation of hundreds of millions. Meanwhile, Ahmad Azmat said MOSTI had awarded a 50,000 research grant to University Sultan Zainal Abidin to develop the COVID-19 health risk assessment and self-evaluation system. This is to detect and manage the risk of COVID-19 infection. He added the system used IR 4.0 technology to detect and manage the risk of the infection, and for a start, it would be implemented among university staff and students. Malaysia will also learn from China's experience in fighting the COVID-19 outbreak through 8 medical experts from the country who arrived in Malaysia on Saturday. Health Director General Dr. Nur Hisham Abdullah said the expert would not only share successes but also discuss the failed method with the Malaysian medical team. Dr. Nur Hisham said the ministry would also share the research on whole genome sequencing of the coronavirus with a Chinese medical expert from the National Health Commission of the People's Republic of China. According to Dr. Nur Hisham, the medical experts are seasoned personnel involved in handling the outbreak in the Hubei province, which is ground zero of the coronavirus. Dr. Nur Hisham said also that among the issues to be discussed were patient care and at the ward and ICU, research as well as the use of specific techniques or methods, such as antigens, antibodies, and so on. Now, in another development, Dr. Hisham also said the Ministry of Health would cooperate with the National Security Council to ensure the health of the movement control order violators. The temporary prisons are well looked after. This is to prevent the further spread of COVID-19. Earlier, Senior Minister Dato' Yaacob announced that 11 temporary prisons to hold MCO violators would start operation on April 23. Meanwhile, UMNO has defended Putrajaya's decision to push back to sea overloaded boats carrying Rohingya refugees heading for Malaysia and called for joint action by ASEAN and the rest of the world. The party's deputy president, Muhammad Hassan, who is popularly known as Tokmat, said Malaysia has exceeded its capacity to host refugees. He said ASEAN must no longer sleep on the issue. And he also encouraged to start working with Myanmar on providing the Rohingya with the right to return and continue to live peacefully in Rakhine State. He called for action by ASEAN and the global community to work on a long-term solution. Temporary shelter in Malaysia for the Rohingya was unsustainable. The Rohingya, who are considered stateless, have accused the Myanmar government and its military of committing atrocities against the community. Malaysia came under criticism this week after the Navy turned away a boat with about 200 Rohingya refugees on April 16, preventing it from entering Malaysia water. Tokmat said the Navy's action was in line with closure of Malaysia's borders to curb the spread of the COVID-19 pandemic. Foreign nationals and vessels have been banned from entering the country during the crisis. He added Malaysia could not welcome any more refugees as the government could not treat them humanely without siphoning resources from other areas. And he also mentioned the welfare of Malaysians remain the government's utmost priority. More than 740,000 Rohingya fled to neighboring Bangladesh after ethnic and religious violence in Myanmar back in 2017, with thousands paying smugglers to help them reach other countries, including Malaysia. Now, the state government will continue to ensure that Malaysians coming back from Singapore go through a strict screening process, while a sharp rise in the number of positive COVID-19 cases in the island republic. Johor Health and Environment Committee Chairman R. Vidyanathan said the entry procedures for Malaysians returning from Singapore have been heavily monitored by the State Health and Immigration Departments. He further said, and I quote, "If they show symptoms during the screening, they will be referred to the hospital for further action." He also said for workers with a working permit and a letter confirming a negative COVID-19 swab test, they will be allowed to go home and are given a health alert card, home assessment tools, home quarantine notice, and a rapid test kit, D13. He said that on a Facebook Live on Sunday. Now, he added that those with a working permit but without the negative COVID-19 confirmation letter will be sent to a health screening center in Johor Bahru, where further action on whether they should be referred to a hospital or a quarantine station would be decided. He said, and I quote, "For those who are not working in Singapore, such as permanent residents or long-term pass holders, they will also be sent to the health screening center where further action will be made as well." Now, Vidyanathan said that the cooperation between the Malaysian and Singapore governments has helped a lot in ensuring the health and welfare of Malaysian workers are well monitored. It was earlier reported that the number of COVID-19 cases in Singapore had exceeded those in Malaysia, with the island republic recording a total of 5,992 cases as of Saturday. Other development that we have here, the Ministry of Health will begin clinical study involving COVID-19 patients in the country. So Health Director General Dato' Noor Hisham said the clinical study will be conducted among COVID-19 patients who met the criteria. So the treatment will be following the approval given by the National Pharmaceutical Regulatory Agency to ensure the safety of each patient being tested. Alma?
All right. Thank you very much. Uh, Remember before you talked about the Medibot, the robots that were being used in hospitals. Are they in use now? You know how many hospitals are using that? I'm just, no, just curious.
Yeah, it's currently being tested because it was developed in one of the public university, and that university happened to have their own hospital. So it's being tested now in their own hospitals. However, that hospital is not really meant to cure or to receive all COVID-19 patients. So what they mentioned was once the report came out and it's a success and all that, they will be sending it to other hospitals where COVID-19 are being treated.
All right. Thank you so much, Ruby, for all your updates. And I'll see you later for more. Thank you for your time, Ruby.
Yes, thank you. Reporting live from Kuala Lumpur, Malaysia. This is Ruby Tinawin. We live in interesting times.